Dr. Ernest Emetole, the project medical referent for MSF in Homa Bay. Today is an important day, the 14th day in the month of November 2022, otherwise the World Diabetic Day. Today is indeed important to us, and not just for us, but also to the community as a whole, because it's also part of our obligation to identify with the community on this important and notable day in the year. Globally, the world celebrates World Diabetic Day on 14th of November. So what then is the importance of this day? Basically, it is no doubt that NCD as a whole continues to increase. And when I say NCD, I'm talking about non-communicable diseases, of which diabetes, being the bane of contention, the bane of discussion today, happens to be one of the chronic diseases with soaring prevalence across the globe. And I want to admit that yes, indeed, for us also in Kenya, the number of diabetic cases continue to rise. In fact, it is said that 2/3 of patients who actually have diabetes are undiagnosed. And that goes to say that there's quite a huge number of patients or individuals who have diabetes and yet they don't understand that they have diabetes. And what is the implication of this? Diabetes being a metabolic problem, such whereby the glucose in the body is not being processed and utilized. And once the glucose in the body is not being utilized, what that means is other parts of the body becomes affected. The eyes is affected in forms of either retinopathy or maculopathy. The heart is affected, the kidney is affected, every part of the body is affected. And for us, this is is important for us to bring to the knowledge of everyone around that indeed the number of diabetic is increasing, and that means we need to have adequate knowledge on how to prevent, take care of it.
So from our perspective, we want to just register our appreciation to all the partners, particularly MSF, that has supported this process. When it began in 2019, 1 out of every 5 cases that were admitted at the country referral hospital had one of the chronic diseases, diabetes, hypertension, and then 1 in every 4 of those came when it was a bit too late. And so they came when they had the complications, and some of them died within 24 hours. And so when we implemented this simplified model, ours is to make sure that everyone accesses treatment and then management and then care for diabetes. And we have opened 3 centers, Nyalkinyi, Marindi, and county referral. And from a community perspective, ours is to ensure that we have the support of the community members, because this is a lifestyle disease and it needs the support of the household. For every patient of diabetes or hypertension, the family needs to give support in terms of the diet, in terms of care, and so in terms of facilitating them to come for clinic. And then we have also mentioned about screening from the perspective of knowing. Once they know they have information, then they'll be able to go for screening even before they are diagnosed.